everybody, Dr. Kaylee Garrett-Zimmerman here, physical therapist, owner and founder of FEM Empowerment and Advocacy, Concierge Physical Therapy. I hope you're all doing well today. Thank you for joining me for part 2 of Low Back Pain series. Part 2 is all about determining what are some of the causes of low back pain. I've made it fairly simple by choosing 2 of the most common low back pain diagnoses that I see. Again, everybody's a little different, so if none of these sound like you, or if these types of low back pain does not sound like what you're experiencing, I do highly recommend seeing a physical therapist. This is not to be used as medical advice, of course, but let me know if you do have any questions or how long you've experienced it and all that good stuff. One thing I want to note as well is paying attention to your symptoms of low back pain is very important. You want to know exactly what causes the pain. How would you describe the pain? What does it feel like? When does it come on? When is it better or worse? Those are just some of the questions I always make sure to ask my patients. So I want to know on a pain scale of 0 being no pain to 10 being stop everything you're doing, take me to the emergency room right now pain. I want to know how much that pain is. What do you do? What activity are you doing that makes that worse? Where do you feel the pain? What activity makes it better? What do you do to make that pain go down? And also, what is it that you're noticing as far as descriptors? Is it sharp? Is it dull? Is it shooting? Is it achy? So, a couple of things that I wanted to go over today is 2 different diagnoses that I wanted to talk about. One of which is just the simple muscle strain of the low back. So, I say simple because it's a common term that we kind of communicate, meaning you sprain a muscle, strain a muscle, and you are hurting, but it doesn't feel like a muscle a lot of times in the low back. What I hear from patients, just based on my own experience, is muscle spasm feeling, to the point where you feel like you cannot relax that muscle. It is squeezing, it is tight, it feels like it won't go away, it pulls you into different positions. You typically get the pain through here on one side of the spine with this type of diagnosis. And it feels tight, it's pulling, it's really sore. If you touch it, push on it, anything like that, it doesn't necessarily help just yet. Now, again, that is a muscle problem. I just call it kind of muscle impairment of the lumbar spine. It's really bad. Again, low back pain. Low back pain is an umbrella term. So many diagnoses under it. So many things that can be going on under that. I'm a big believer that your spine is one of the most important things that you need to take care of. You need to do mobility, you need to do range of motion, you need to do strengthening in the low back at all times, every day, a little bit every day. So as far as the muscle goes, that is, again, going to feel like that pulling, that muscle spasm type feeling sensation that you get. You're going to notice that it changes or it gets worse when you do certain movements. So whether it being bent over, you feel it, but it does not radiate, meaning it does not go down into your legs, it doesn't go into your feet, it doesn't go into your buttock. You really just feel it right there in your back. You can feel different muscle impairments, meaning if you feel a little bit of radiating pain down the leg, and if you palpate right kind of in the buttock, you're going to notice a little more of that sensation. So that can potentially tell you that one of your butt muscles, your piriformis, glute muscle, something's going on in that region. But again, that muscle feeling is going to feel like a tight muscle stretch. You can't get rid of that discomfort. It just feels tight, it's pulling, it's aggravating. You can't sit on it, you can't lay on it. The positions that you choose affect it. So sometimes if you're laying down on your side, it makes it feel better. Whereas if you are laying on your back or your stomach, it feels tighter. But a lot of patients will describe it as a tight or a muscle spasm. Now, treatments for that vary. We're going to go over a little bit of assessment on the next video as far as like noting your mobility and everything like that. But if you palpate the muscle, and right where you touch in the muscle, if you do something like this and you kind of roll in and out down into the lumbar spine, and you notice that that's tender or it makes you kind of jump and things like that hurts, you have a muscle impairment. Same thing with the glute or the buttock. Tissue massage, deep tissue work, manual therapy are excellent for that. Any type of massage is great for that. Stretching, mobility, and then following up with strength. The next one I wanted to talk about is a disc impairment. Now notice I'm not calling it disc herniation, disc bulging, or anything like that. The reason is because I find when someone is given that diagnosis, that becomes part of them. You are not your diagnosis. You need to realize that it is an impairment, but it's treatable. It's something that can be fixed. It's something that can improve. A disc impairment is going to be where you're feeling more so of the irritation. You may already have that muscle tightness. You might have both of these, by the way, but you may have that muscle pulling, that tightness, that irritation there. But then you're going to get a little bit more of what we call radiculopathy or nerve pain. A lot of people refer to this as sciatica. You may get that pain all the way down into the foot. It may not go that far. It may go to the calf muscle. You may feel cramping or pulling in your calf. You may have pain or pulling in the thigh. You may have pain or pulling in the glute. A lot of times that's the descriptors that I get. But if you're having disc problems, most of the time you will have that nerve pain or that radiating pain to somewhere else. Now, very occasionally, very rarely, but occasionally you'll get the pain that goes up into the mid-back. So you'll feel more mid-back pain versus going down into the leg. But anytime you have trouble moving your foot or your ankle, you have calf pulling, calf tightness, calf pain, hip pain, things like that, you want to kind of assess the low back. That's why I say physical therapy is so important for you to get addressed. You want to make sure that you get down to the cause. Low back pain's tricky. If you treat the impairments or the symptoms that you're having, but you don't get down to the cause, it will come back because you're standing up all day, you're fighting gravity, your spine moves a lot. Remember the anatomy video in part 1 where we were talking about how much that low back moves. It moves a ton and it has to take the rest of our upper body weight. So if you think about that and you don't take care of those discs, there's going to be a problem. Now, something cool that I want you to think about your discs too is laying flat is so important. We're going to talk a little bit more about this when we get into the recommendations and things that you can try. But laying flat is really important because what happens when you're laying flat, you're not against gravity, nothing's bent, nothing's stretched, everything's relaxed, and you are able to get nutrition and good materials going in and out of your discs. Your discs actually get fed when you're laying flat. So I want you to keep that in mind. Low back pain, unfortunately, is very common. I mentioned it in the first video. 100% of us get it at some point in our life. Being able to assess your symptoms, write them down, address them, see when it comes on, what makes it worse, what makes it better is very important. Be aware of your body. Know what's happening. If you have any questions about your symptoms, if they don't line up with either of those things, please feel free to reach out. I would love to either connect you with a physical therapist or connect you with some resources that might help. Otherwise, I hope you have a fantastic rest of your day. Don't forget to join me next week for parts 3 and 4.